Thank you for being here. My name is Phil Strom. I'm the Delta County Prosecutor. I will go ahead and do some introductions briefly and kind of tell you about why we're here, and then what I'd like to do is turn it over to Rob LaMarche to tell you a little bit more about the fundamentals of our program that we're here to discuss, then open it up for anyone else that's joining us on the panel to weigh in, and then open it up to the media representatives. If you have any questions, we'd like to be able to answer your questions too, because this is a new program that is just getting off the ground, and so you may have questions. We'd like to be able to answer those as well. So to my left and to your right at the end here, we have Matt Smith Jr. from the Community Foundation. We have Mr. Charles Becker from the Delta County Community Foundation as the board chair. Ms. Joy Hopkins, VP Patient Care Services, Order of St. Francis Hospital. Again, my name is Philip Strom, Delta County Prosecuting Attorney. Mr. James O'Toole, Escanaba City Manager. Lieutenant Robert LaMarche, Escanaba Department of Public Safety. And Ms. Christine Gagnon, who is a volunteer angel with our program. This is a program, the Angel program, that is a unique program to the state of Michigan. It has kind of come as an idea that started with Escanaba Public Safety after seeing some reports from different agencies on the East Coast, Massachusetts specifically, who has a similar program in Gloucester, Massachusetts. I was approached to do some more study on this program with Escanaba Public Safety to see if it was viable for Escanaba and whether it was worth pursuing resources and putting time and energy into it. We talked to Chief Campanello of the Gloucester, Massachusetts Police Department and got his opinion on it. We also took this to the task force here in Delta County, the Substance Abuse Task Force, where some of the members up here serve on the task force, and we bounced it off that group. And then finally, with the help of the Community Foundation and other local faith-based organizations, we've been able to secure some initial funding so we can start this program up. We pitched this to the community at a public town hall meeting at Bay College back on December 1st. And due to the diligent work of Lieutenant LaMarche and all of the members at Escanaba Public Safety and the City of Escanaba, we're up and running and ready to go here in March. So just over 3 months out of getting some feedback from the community, Escanaba, their staff at Public Safety, I know Jennifer Spricks has been instrumental in doing a lot of the legwork too. And then a lot of the community service groups have come forward, and so we've been able to identify volunteer angels. We have funding thanks to the Community Foundation, and we have the process in place thanks to Escanaba Public Safety with the support from Jim O'Toole, and that includes OSF, who is willing to help us do some medical screenings that are necessary as part of the process. What we've come to realize here in Delta County is that drug abuse and drug addiction is bigger than just a criminal issue. It's a public health issue. And so we need to start looking at drug addiction and drug abuse with a more open mind. What that means is we're not going to stop prosecuting drug offenses. We want to be clear that we will continue to be very responsible and very proactive in prosecuting drug offenses, especially delivery and manufacture of controlled substance. That is our priority, to prosecute, arrest, and convict manufacturers and deliverers of controlled substances. We want to extend additional options to those that are suffering from addiction, and this is one way that we can do that through the Angel program, through Escanaba Public Safety. What we've done recently is we've done a lot more listening and a lot less talking. And we've talked to addicts and we've talked to families of addicts. And what we've come to find out is something that probably isn't too shocking. No one really wants to be a drug addict. And so how can we be responsible citizens to help people out of that lifestyle of addiction? Unfortunately, here locally, we do not have a whole lot of resources for substance abuse treatment. In order for someone to receive effective inpatient substance abuse treatment, they have to travel outside of Delta County. And that's difficult, it's expensive, and it's time-consuming. What we're able to do with this Angel program is help bridge that gap. We're hopeful that substance abuse treatment will become more accessible here to our local population, and we're ready to continue listening as we move forward with this initiative. So without saying much more, I'd like to turn it over first to Lieutenant LaMarche to give a little bit of the structure and the background. It's nice that we're able to use some resources through the affiliation we have with the Police Assisted Addiction Recovery Initiative. That's a national organization. We've been able to use some of those resources, and Escanaba's been able to craft some documents and some contracts based on those resources that fit our program. And I'll let Lieutenant LaMarche talk a little bit more about that.
All right, thanks everybody for coming. How our program is going to work, and like Phil said, this is taken out of Massachusetts. So we've taken their program, applied it to our area, and had to make some changes to it just because of our regional location, lack of resources. So the premise is someone that wants help can walk into a police department, and instead of us taking them and putting them in jail for their drugs, we'll take their drugs from them and throw them in the garbage. After that point, we'll walk the person back to our department. We'll have an interview with them. We'll go over some paperwork at the time, just the basic questionnaires. And after we're done with that, we'll start making phone calls. Once they're accepted into the program, we have to call. We have two places set up right now. One is in Gastra, Michigan, and one is down in Muskegon, Michigan. And they both have little separate intake processes. One might take a little bit longer than the other. The one in Gastra is the primary one that we're going to use because it's almost immediate. When I call up there, if they say, yes, we have a bed, basically what I do is I call one of our angels. One of our angels, like Christine here, she's volunteered to come up here today. She's got a unique experience with this, not with this program, but previous life history. And so I would call Christine. She'll come down to our department. She'll meet with me and whoever walks through our department. And after we do a quick introduction and we get a placement from Gastra, let's say, that person is on their way to Gastra for their treatment facility. Their treatment facility is up to 8 months long, and from the research that I've done is that's what works. Long-term facilities, not the short-term ones don't have as high a success rate. I went and visited a week ago Tuesday. I actually went up there, visited the facility, and I felt really good walking out of there. It's a tremendous support group that they have up there for their people. Most of the counselors up there are former addicts that are there to support the people. So they've, like the gentleman that I talked to up there said, you're not going to have anyone that comes in your door that's going to come through this door that has done nothing that we haven't done. So they're all previous past experience. So, and then after that 8-month treatment facility, if they graduate that treatment facility, we have a local businessman right now that's willing to hire that person. So from the time that they walk through the front door of our department to the time that they graduate the program, they're going to have a job waiting for them. And he had called me yesterday. I talked to him, and he asked, he's like, is it okay if I spearhead an effort to get more businesses on board to hire people? And I said, absolutely. So he's going to be helping me through the Chamber of Commerce develop more businesses around here so we don't forget them after 8 months. They'll have a job, and we'll do as much follow-up as we can with them. Our other facility that we have set up is through Muskegon. It's the same principle. We'll drive them down there. The only difference is each facility has a few different intake requirements. So that one is they need a TB test that has to be taken before we can take them, and that takes about 2 days to get that done. So if someone were to walk in, we just may have to adjust the time schedule, but we're going to be there to support them through those couple days. And I talked to Christine a little while ago, and she said, you know, with her experience, there's a time situation there where you have to act. So she said if we have to delay or wait to give her a call, and she'll basically hold that person's hand until they're gone. Stay in touch with them, keep up with them. And again, once they graduate in Muskegon, that one is about a year-long program. Again, they'll come back to Escanaba, and they're going to have a job waiting for them at that point. And just looking at the success rates for these two places, if you stay the whole course for the either 8 months or 1 year, they have about an 88% success rate, which, when you're talking addiction, is incredible. I don't know exactly what the other ones are, but I want to say they're in the teens anyway, from what I've looked at the other treatment facilities that are provided. So in a nutshell, that's how our program is going to work. I'm sure there's going to be a few little bumps in the road along the way, but you know, we're going to figure this thing out.
Escanaba Public Safety is the first law enforcement branch in the state of Michigan that's partnering with the national group Police Assisted Addiction Recovery Initiative. We know this is working on the East Coast, and it's making its way to the Midwest. And so I think it's really important to recognize how innovative our local agency is being here. And we're doing it responsibly. We haven't just rushed into this. We've taken a lot of time to study what's working for other similar communities, and that's been kind of on the forefront. The other thing that's very important to recognize is this idea of treatment to employment is something unique nationally. It's something that kind of developed thanks to our local community closeness, I would say. Local business community being cooperative with local law enforcement. This is not an aspect that many of the other programs or police-assisted addiction recovery initiatives are doing. So not only are we on the cutting edge in Michigan to try to affect our substance abuse population positively, we're doing so in a way that I think is much more thorough than some of the other agencies that might have similar programs going on. So very difficult sometimes to try to think of new creative programs. So hats off to all of our local law enforcement, because I think this is also a cooperative effort with the other local law enforcement, including the Sheriff's Department. We've gotten feedback from Michigan State Police, Gladstone Public Safety, so they've been influential in working this program through and getting it to the point that it needs to be. But really, you know, Escanaba Public Safety, what an incredible thing to bring to our community, and something for us as Yoopers, as Delta County residents, to be proud of, to be on the front end of this, and rather than being reactionary, we're able to be a little bit more proactive to try to make some change. I'd like to give an opportunity from the representatives from the Community Foundation. They were very generous in giving us a grant to help get this off the ground. There are costs associated with this. We don't ask the Angel volunteers to do this for free. Their gas mileage and their possible overnight lodging is something that we need to account for. There are simple, what might seem like simple things, care packages for the addict that might come in. There are costs that come with any sort of new program. And so if it hasn't been said enough, let me again thank you from all of Delta County for the generous donation. Without results, it's hard to believe in a program, and so we appreciate your trust and your donation. Is there anything that you'd like to add into the conversation?
Yeah, just a few words about it. The Community Foundation for Delta County is really about serving the citizens of this county and promoting the Upper Peninsula as a whole. And several months back, Officer LaMarche came to our board meeting and basically promoted this program and talked about it. And we were pretty excited about it because of the success rates and the fact that it's a voluntary program and it was going to help the citizens of Delta County. So the Community Foundation, our board, decided voted to make a grant of $10,000 to begin initially funding this program, which is really to help fund the Angels and cover some of their costs for getting things established and getting folks to the treatment they need. And so just on behalf of the Community Foundation, we're very, very glad to see it taking place, and we think it's an excellent program, and we love to see the fact that it not just goes towards treatment, but also goes towards getting folks in the working community.
Another key organization involved in this process is OSF, and we have a representative, Joy Hopkins, who also sits on the Substance Abuse Task Force. Part of the process for the intake is getting a medical screen or some sort of clearance that the individual participant is going to be healthy enough and safe enough to do the transport. And so we've asked OSF for some help and some guidance on how to do that responsibly. And I know that they've been at the table every step of the way assisting us. Again, thank you to OSF. Anything from the healthcare standpoint that should be added or that you'd like to elaborate on?
I just think this is going to be great for the community because we see babies born addicted on up to people of elderly age, and I think if we can break the cycle of addiction in some of these families, that will just be amazing results down the road. It won't happen overnight, but one person, one day at a time, I think we're going to make great strides.
We have realistic expectations going into this, and here locally we see generations of drug abuse from parents to children to newborn infants. It's something that spans much bigger than just the individual that's suffering from the addiction. So we're hopeful that if we can help one person, we're going to be on the right track for helping a lot more. We know that not all individuals that go through treatment are 100% successful all the time, and so that's something that we need to ask the community to be patient as we kind of navigate through this as responsibly as possible. Mr. O'Toole, you've been there since day one, since I've been involved, and anything from the city of Escanaba that you'd like to mention?
Well, first off, I want to commend everybody up at this table and the groups that they represent, by picking up the ball and running with it to come up with a program that I think will pay dividends to the community. Back in last Labor Day, I was reading a newspaper and I came across this article on the Gloucester Angel program. And in this article, they talked about how they implemented a program to help addicts. And as a result of that, they saw crimes such as shoplifting, larceny, breaking, and entering drop by 23%. I was sitting here reading this, and I'm constantly getting briefed on crime statistics, clearance rates, and everything else related to the city of Escanaba and the drug situation in Escanaba. So this was of great interest to me. So when I got back to work on that Tuesday, I called my Chief Vanderlinden and Lieutenant LaMarche and had them come up to my office, and I said, hey, I read about this program. I want you to find out everything about it, the pros, the cons, the goods, the bads. And so they went to work on that, and I'm very happy, here we are several months later, launching the program. And I'm very happy that the city of Escanaba was the first in the state of Michigan, because I think this is going to be a model program for everybody to follow, and to go from addiction to employment is a great thing. And think about it from a police officer's point of view. A lot of these crimes, breaking and entering, shoplifting, if they're not having to dedicate time and resources to these because the people who were committing these crimes to feed their addiction are now being helped. I think it's going to have a big payday at the end for everybody and for a society as a whole, and everybody is to be commended.
This program does not work without community volunteers that serve as the angels who kind of swoop in regardless of what time of day or night it is, regardless of what day of the week it is. And so before I pass it on to Christine Gagnon to maybe weigh in or tell us as much about her experience as she wants or how she envisions the angel program working, a lot of thanks goes out to other community organizations. I know the Wells Lions Club came up with about 10, 15, 20 of their members that didn't hesitate when called upon to be helpful and to go out of their way to step up to the plate and really be part of the solution and not part of the problem. We're hopeful that other community organizations will also identify members that want to be volunteers and be part of the solution. And we're always signing up new angels. I know as soon as Lieutenant LaMarche has a chance to take a breath, he's got another person from the community that wants to be helpful coming forward. So Christine, if you don't have to say anything, but if you have anything to say, now's the time.
This program is going to have a tremendous impact on the community. Being that I've gone through the situations that these people are going to experience, I think I have a little more insight to them coming in, and I can relate to what they're going through. It's not an easy process. It's scary. Like I was telling Lieutenant LaMarche, there's a very small window when you decide that you want to quit, that you're actually going to quit. So hopefully by being there and talking them through it and letting them know that there's a better life after drugs, along with all the angels, whether or not they have the experience, just somebody being there to support them through the entire process is an amazing thing. And I'm blessed to be a part of the program. Seeing the community, I've moved away for a while, came back, and it's just not the community that I know. Saturday nights, we used to cruise up and down Main Street. There's nobody out anymore. I've lost probably 10 friends to drugs since I've been gone, and it's just not the community I want my niece and nephew to grow up in, or anybody's children, or family at all to be involved in. We need to be a community again. So hopefully one by one, even if we help just one, which it's going to be much more than that, we're a success. So.
Any last words about the interest in the status of the program? Can you tell us, are we up and running right now, or where are we at?
Yes, today is our kickoff day, so we're going to be up and running. So if someone wants to walk through our door today, they can. And I can't. This doesn't happen without the community support, financially and through our angels. We're getting close to almost 20 people that have volunteered their time, their vehicle, and a part of their life to help the community. And as a police department, we can't enforce our way out of this. We've been trying. We've been putting people in jail, and then they get out, and then we put them back in jail. And I just kind of do some facts and checking, and if we take one person and we can spend 1 hour with them as a police department, get them away for 8 months to 12 months, and have them change their life and come back as an asset to our community, like you said, it's worth it. Because if I take one person for shoplifting and our officers have to arrest that person, how many hours do they have just through writing the reports? Then it goes to the prosecutor. Then they're in jail, and the whole time, and then they get out and they do it again. And it's just it's a repetitive thing that keeps on going. So if we can change that culture, and I believe, like the city manager said, is this program has shown results in other areas. When you're talking a 20-some% crime drop in a police department is huge. The last time I looked, it's a town of about 40,000 people, and over it was about a 4 to 5 month span, he had 280 people come through his door that he has got off to get treatment. So the community support has been phenomenal. I get calls. They're always on my voicemail. I'm getting emails constantly from people. And the more that it gets out there, the more people want to help. The more that this program gets portrayed through the media, it's every time we do something like this, I'm guaranteed I'm going to get some calls and I'm going to get some financial support, and that's what is needed from all of our people. And with all the people helping us, I truly believe this is going to work.